most of the students there did not have underwears because they couldn't afford underwears.
Oh my
So
God.
affording pads was a whole separate issue. They couldn't afford underwear. So we had to do another assessment. Because if you go to Madhes and talk about Chhaupadi Pratha, they'll be like, what is that? Like, we don't practice that. We have our own taboos. And child, how do you go to the police station and get your parents, file a complaint against your parents and have them pay 3,000 rupees in fine or send your parents to jail for 1 year? Like, what's going to happen of you in that situation? You have these books saying things like you need to wash your vagina with Dettol once you are done with your periods, or if you need to.
Hi, Jesselina. How are you?
Hi, Palisha. I'm good. Thank you so much for having me today.
Hi. I'm really excited to have you on this podcast. We're going to talk about really important issues for the entirety of the podcast. Before we get started, why don't you introduce yourself briefly so the audience gets an idea of who you are, what you do?
Thank you. Hi, everyone. My name is Jesselina Rana. I am a human rights lawyer and co-founder of Pad2go, which is a social enterprise that we established, Shubhangi, my co-founder, and I established in 2018 in Nepal. It's been over 5 years now, and we work primarily in the menstrual health sector of Nepal. And we were the first ones to introduce sanitary napkin vending machines to the country.
That's amazing. I remember seeing the post. I think it was some Nepal, it was Routine of Nepal Bandha or somebody posted, and I remember seeing that for the first time. It feels like yesterday, but it's been in 2018, right? Y'all started in 2018. Yeah. Again, thank you for the all the amazing work that y'all do. So I want to know, what was the vision behind y'all starting Pad2go? What was the mission, or what really made y'all start this organization?
So, if we go back to 2018, to be honest, I think we were very young. I was 22, Shubhangi was 21, and we were initially in this phase of our lives where we had just graduated from university. I graduated from law school. She'd graduated from engineering school back in India, and we'd both moved back to Kathmandu. And we were looking for jobs. And in that process, while we were looking for jobs, but also I think trying to find ourselves as well, we met each other for another project, and that project never ended up happening, but we started to talk about some of our experiences. And despite coming from very different professional backgrounds, one of the things that was really intersecting for both of us was our experience as young women in Kathmandu. And I think as we started to talk about that, we came to our experience as being women who menstruate. And I think that's where we started off to talk about if there was any possibility for us to contribute. And while doing all of that brainstorming, we talked about how in India there were these vending machines, but surprisingly, we couldn't find it anywhere in Nepal because, as you know, in Nepal, even vending machines for like snacks and stuff like that is quite rare. In fact, I just saw one yesterday on someone's story, and it's still something that is new as a concept. So we realized that people hadn't really entered into this field and approached menstruation or access to menstrual products through the vending machine. So initially, we really started out as a passion project. We thought, we were so naive. We were like, yeah, let's buy a few machines from India and get it back to Nepal, and we'll just put it in a few places. And then that's when we started to talk to banks, and we were like, okay, and we went to India, we found some vendors, and they were like, yeah, okay, we'll send you the machines. And then we go back to Nepal, and then the bank people were looking at us strange, and they were like, wait, you need to have a company, you need to have an export import code, you need to do all of this, and then you come back with, like, the quotation and the name of your vendor and everything. So it actually started out as a passion project, and it grew as a business big and a social enterprise because of all the circumstances. And that's I would say we started building on it as wanting to create a more holistic avenue for mental health. So I guess the vision was initially a very small passion project, and then over the years it's grown into something more holistic.
That's amazing. So it started just as you all wanted to install vending machines. That was it. Okay. Okay. Um, I want to talk about the stigma around menstruation. So I've lived in the US for about 6.5 years. I came here for my studies, and I have always been very active on social media wherein I post about social awareness and like women's issues and whatnot. And I remember posting something about menstruation, and a few women reached out to me saying that it's still practiced in their homes, and they've lived here since they were like in their whenever they moved here in their mid-teenage years. So it's been a long time they've lived here. They've come over from Nepal with their families. And I was shocked to see that the families are still forcing that practice, like, onto these like women who are now adults, but like that has carried well into their adulthood. Uh, what kind of challenges have you faced, be it in Nepal, here in the US, or whatever circumstances you've come across? What kind of challenges have you faced when it comes to spreading awareness about menstruation, menstrual health?
I think some of the challenges, and I think, when we started out, as I mentioned, we were very young. We started out as people who were passionate and wanting to contribute, but realized that there was so much for us to learn and unlearn even through the journey. And I think something that, like you said, you were, surprised to hear about the fact that it's still practiced. One of the things that we had to sort of unlearn was that it's not a rural urban divide that mandates these practices to continue, because there are rural communities that don't practice it, and there are urban people in Kathmandu who practice it. And it's a lot of intersection of caste. It's a lot of intersection of where you live, your geographical location, the community that you live in, what caste dominant community is it where you're living in. And it's got to do with that more than just education versus lack of education, or rural and urban, as we would, from a very Western, or not even a Western, a more peripheral approach, think that, it's in Kathmandu, it's probably liberal, everyone's out and about, you're probably not practicing this, and, conversations must be healthy. Whereas, in rural areas, maybe it's not like that. But some of our more liberal conversations have happened in rural areas. Some of the schools that we've approached have been more open to having both boys and girls in rural areas. In schools in Kathmandu, the initial schools that we reached out to, they were still hesitant for boys to be part of the workshops that we were leading. And
Wow.
and this came as a surprise to us, because whenever you start a social venture or a social project or a social anything, I think one of the initial reactions that people have on social media is, why are you doing all of this in Kathmandu? Everyone has access to things in Kathmandu. Take it somewhere else. And we obviously want to specify that most of our vending machines are outside of Kathmandu Valley. We have vending machines across all 7 provinces. Over the past 5 years, we've placed about 400 vending machines in schools, colleges. But the challenges that we've seen is not centered around whether you're from the rural area or urban area. In fact, the challenges are centered around schools which have not been exposed to menstrual health training, menstrual health workshops. And there are a lot of organizations, nonprofit organizations, doing great work in some of the rural communities. And students there have already been exposed to conversations around these. And somehow in the urban schools, especially even private schools in Kathmandu, they've just taken for granted that, probably the parents have had a conversation about this. And I think that was very eye opening. And that was a challenge for us to sort of understand and navigate around the fact that it's not just an urban rural divide. I think the second one that I was mentioning and related to this was in terms of caste and geographical location. I think we understood through time that, we needed to contextualize our workshops even as per the geographical location. Because if you go to Madhes and talk about Chhaupadi Pratha, they'll be like, what is that? Like, we don't practice that. We have our own taboos and we don't practice that. But there are different challenges, and you need to talk about what's going on there rather than what's going on in Western Nepal. Similarly, in terms of like, caste dominant communities, we went to Sindhu Palchok, which is more Tamang dominant. There, their practices were very minimal. They were very open in their conversation. Their practices were minimal. The conversation was easy because there were students had already had these conversations in their homes, in the Tamang community. Right after Sindhu Palchok, we went to Dhading. Dhading is more Bao, Newar, Chhetri dominant. And there it was so difficult to even have a conversation because even the teachers were so shy to have a conversation around menstruation. So I think one of the challenges that we've had to learn ourselves and also sort of bring out through Pad2go's work is that the taboos are not practiced in the same way that we would imagine it to be. We've met people from Kathmandu who've told us they are mandated to sleep separately from their husbands when they're on their periods. So it really was an eye-opening experience for us, and to understand that we need to contextualize and learn from this and model our work accordingly, because some of the biases we have or the stereotypes we have don't actually exist in the ground level.
Right. I remember us having this conversation when we were back in school, and all of the girls were separated from the boys, and there was like some awareness about menstruation, and we all came back to our classes, and like we felt so shy to even talk about it. None of us even like opened up what the conversation was about, and all the guys were like, "Oh, what did you talk about? Why were you all separated?" And also in high school, in +2 college, same. Like the assembly, once the assembly was over, the guys would go back to the classes, and the like talk around menstruation period would just be given to the girls. And I really didn't know that the practices were so different from region to region and caste to caste. So that's very interesting. Talking about rural areas, what's the condition like there? Because I remember, I think a few years ago, probably around 2019, 2020, I did a webinar with Chhaupadi organization who are based here in the US. And we had invited some of the people back in Nepal who are working on the same issue. And some of the stories they shared were like really, really horrific. Like women who were forced to do Chhaupadi Pratha, of course, like whenever they would be in their period, they would have to live outside. And if they had snake bites and whatnot, people still wouldn't take them to the hospital because they would be considered like untouchable. So that was like the extreme end of it. Like I didn't know that the condition was so bad that even if like somebody had a snake bite, you wouldn't touch that woman because she was menstruating. What is the condition like in the most rural parts in the of the country, since you've gone to many of those? Are they able to afford period pads and sanitary napkins?
So obviously, like the situation that you mentioned, unfortunately, it does still exist. It like I mentioned, it's more towards Western Nepal. We've also seen over the years in 2017, right before Pad2go started, they did criminalize Chhaupadi, but from our experience, we're talking to women who are still undergoing Chhaupadi. Some of the things that they told us, we had a group of women from Bajura that we were talking to, which is in Western Nepal, and they sort of told us that it's very commendable that the government took the step to criminalize Chhaupadi, and over on the outside, at least for on the outside, it seems great. But the problem is, if it's your parents who are imposing this condition on you, or if it's your family members imposing this condition on you, and if you're a 15-year-old child, how do you go to the police station and get your parents, file a complaint against your parents and have them pay 3,000 rupees in fine, or send your parents to jail for 1 year? Like, what's going to happen of you in that situation? So what is the actual outcome of criminalization of Chhaupadi if you're not empowering, if there's no, not even not empowering, if there's no way for people who are undergoing this, especially young girls who are dependent on families for everything from education to food to livelihood, how does it make sense for them? How does this law make sense for them at all? And I think that was a really big question for myself as a lawyer, because you know we we demand for certain laws, but then when you look at the actual implementation of it, or the consequences of it, it does have dire consequences when it's not implemented right. So it is still a situation, and I don't know if the law criminalizing it has been helpful at all. I'm sure there have been situations where it has been helpful, but it does come with its own set of challenges. So there are situations in some parts of rural Nepal where Chhaupadi Pratha is still practiced. But something I want to highlight is, Chhaupadi Pratha is putting someone in a cow shed, during their periods and considering them untouchable. The equivalent of that still exists in modern day Kathmandu when you're banished into a room inside your house and not expected to go out. So the idea around Chhaupadi exists irrespective of where you are in the country. So the practice may change in its form, but the idea around it still exists in different parts of the country, whether it's being told not to go to school, whether it's being told not to go to the kitchen, whether it's being told not to go to the prayer room. The idea that you're untouchable exists across the country, and it's not just in rural Nepal. But having said that, in rural Nepal, there have been places where we've went, and I remember we went to Madhes, and it was not a it wasn't a place too far from the airport, and we took a car. It was about a 3 hour drive, and the first thing that I noticed when we went to the school was the power lines, the electricity power lines had no cables. So I asked the person who was driving the car, why are there no cables? And they said, well, there's no electricity in this village. So many politicians have promised, and every year they erect these pillars and say that electricity will come, but it has never come. So we went to a village that has no electricity, and um, it probably was like 35, 40 degrees Celsius. And we went there and we met some of the students, and in Madhes there's a lot of land, so the schools were really large. And we went there to place the machine, introduce sanitary pads, and that's one place where I really had an eye-opening moment, because when we were introducing the sanitary pads and products to the students, we obviously tell them what the pad is and everything, but one of the students asked us if they could tell us how to wear the pad, because most of the students there did not have underwears because they couldn't afford underwears.
Oh my
So
God.
affording pads was a whole separate issue. They could afford underwear, so we had to do another assessment of ensuring that when we're providing pads, all the other circumstances are also taken into consideration. It's not just placing the machine and providing the pads. And there were some students who could afford the underwears. And another thing that they told me, so I was asking them, so if this is the first time that a vending machine is being placed and you're getting access to pads, what did you use when you had periods? And I think that was the moment I was like, there's so much work to be done. She told me that whenever they had periods, they would go to the female staff or the female teachers, and the teachers would rip out the banners that were placed outside of the school,
Oh my God.
and they would rip those banners and give them to students because they had no other option. There was no cloth, nothing available in school, so that was what they would get. And I'm thinking to myself, this is a place that is like 3 hours from the Nepalganj airport. How is this the situation here? Right? There are
Right.
places which are much more remote. So I think in terms of, remoteness and, the rural divide, I think there's so much work to be done. In 2019, the government came out with their policy of ensuring that every public school is given free pads. But even there, it's a great program, and we hope it's implementable to its maximum. But we've seen so many challenges in that. There's just recently there's a corruption of a young mayor who tried to take money in trying to buy pads for the schools. When we went to the schools, there was the school where we went to where all the pads that the government had provided for free were locked in a room, and no one had any idea that the pads existed in the school. There were
Wow.
teachers who were taking the pads from the schools and selling it outside. So there's so many challenges, and there's so many intricacies, and there's so many schools, so many people who need to be benefited. More than half the population, women are 51% plus menstruating individuals who may not identify as women, right? There's more than half the population who needs access to this, and it's such a challenge from so many different ways. So I think with Pad2go, irrespective of it starting as a passion project of just putting up machines, we've really worked on our mission and vision to be as holistic as possible. We're assessing educational curriculum information. I'll share one of our links where we did this whole research on the types of books and the information that's given out in these government curriculum books in Kathmandu. We didn't even go outside of Kathmandu. You have these books saying things like you need to wash your vagina with Dettol once you are done with your periods, or if you need to change your pads every 24 hours, or you'll get STDs. And I'm like, what is this information, and who is saying yes to this information? So we're trying to see it from a very holistic manner. We understand that there are challenges which impact impact everyone, but let's say maybe more on economics of it. We're trying to remove the VAT on period products. We're looking at education and menstruation. We're looking at access to menstruation. We're also trying to look at the environment and menstruation, but that has been such a challenge for us, and we know we want to focus on that. But introducing menstrual cups has been really difficult. So introducing cloth pads is really difficult because students walk 2 to 3 hours to school every day. So how do we tell them to be environmentally sustainable when they need to, they don't have access to a wash basin to wash that cloth in school? So like, what do you do? So it's been such a challenge to sort of balance everything, but we're really hoping as we go, things get better. And, I know I've painted a very bleak picture, but over the years, there have been developments, and over the years, there are things that are becoming better. I remember during 2015, during the earthquake, the relief materials didn't even consider menstrual products, and from the government side. And when the pandemic hit, we were really, we had a consultation with the government and with UN Women, and we really pushed on the fact that it's not just the relief materials that need to be given, period products. You need to ensure that the supply side of it, that is the menstrual pad producers, manufacturers, importers, are being given the special pass to operate, because without that, it's not going to reach everyone. So we're trying to be as holistic as we can, but we're really hoping that things change for the better, at least for the next generation.
Yeah. Thank you for sharing the stories. The one with the banner, that really shook me. I did not expect that. So I think whenever we talk about period poverty, that kind of falls under the whole umbrella of poverty, right? Like if you're poor just as is, you wouldn't be able to afford a period, like a sanitary napkin, as well. So talking about the vending machines, you said you've installed, Pad2go has installed over 400 vending machines. How does that work? Whenever you go out to these rural places, so you set up a machine, who bears the cost, or like what's the difference between installing a vending machine in a rural area, uh, uh, as opposed to installing one in a, like, in a very private school that can easily afford to buy one? How does that transpire?
Definitely. I think that was an important consideration for us to have when we began, and thank you for bringing it up. Even for private schools, there are schools in Kathmandu who've been able to put it up as they have the funds for it, and we're really happy that they're able to do that. But even government schools in Kathmandu, or schools across the country, we reach out to donors. We have banks, we have international organizations, charity organizations. I remember one of the bigger orders was from the Nepali Association in Australia. So we have funding that we get from different organization, and when I say funding, it's mostly to just buy the machine, and we go do the programs, we set it up. Sometimes they want to do, like, the organizations want to do it by themselves, so we provide the vending machine to them, or if they want us to do it, takes a bit longer for us to plan out our trips and everything. But we are able to do that. So I think it's been a lot of collaboration with different public plus citizens, public institutions plus private institutions who fund these machines to be placed across the country.
Okay, so I want to get into the details just a little bit. So if I were in a rural area in a school, right? You set up the vending machine. I haven't seen it in person. Sorry about that. I wasn't in the I was in the US whenever the program started. So how would you have to, like, just like a regular vending machine would work? You put the coin in, you put like a note in, and it comes out, or like how does that work for people who are like, they can't really afford to pay money to get the pad, right? How does that work for these women who are in these rural villages? How does that work for them?
Thank you. So I apologize, I didn't clarify earlier. So two things we wanted to make sure when we started the vending machine. One, um, that is not electricity based. We realized that electricity is a challenge in Nepal for a lot of places, and we didn't want it to be electric, battery operated, things that would require some form of constant updating. So our vending machines are completely manual. It operates on a token. So the second thing that we wanted to make sure, it was not monetary based. Yes, you can monetize the tokens if you want. For example, QFX. initially when we put the machines in the different movie halls in Kathmandu, they wanted to slightly monetize the token. So maybe 10 rupees, 10 rupees for, or 5 rupees. But later they've just provided it for free. So if you go and get a token from the counter, you can just go use it in the bathroom. There are schools which want to monetize it just to make sure that students aren't misusing the pads, that they aren't taking 10 when they just need one. But there are schools, because, and I think one of the benefits that has happened with the free pad system by the government is that they're able to use these vending machines without any monetary value. They're able to distribute the tokens, and the students are able to go and use it whenever they want. So it is a token based machine and completely manual, doesn't require electricity, battery. And because it's a token based system, you can monetize it, like this institution can monetize it if they want, but we recommend not monetizing it, or monetizing it very slightly if you don't have pads from the government, free pads from government, and you're like dependent on a donor or things like that. Monetizing it maybe 1 rupee or 2 rupee, just to have some form of responsibility for the people who are consuming the pads. But in most schools, it is, it's just a token that's distributed to students, and then they go use it in the bathroom.
Okay. So in these rural areas, you install the machine, right? And once they are out of stock, like, is it you all that provide the pads again, or is it like how does that work? If are they dependent on the government, or like, or the institution or the school? How does that, like, how does that cycle keep going?
So definitely, it's an important consideration. So one is the government has provided free pads for a lot of schools, so a lot of people are able to benefit from that. The second is, if it's a donor organization that we're getting funding from for the vending machine, we also recommend that they give funding for pads for an extended period of time, at least until the school can sort of figure out a budget to provide pads for the students, or the school can lobby the local government to make sure that they get the pads from the local government. We also have, and this is for everyone across the country, what we've done is from the get-go, we collaborated with two companies, Whisper, that is an imported company, and Safety, which is a Nepali pad company. And through our collaboration, once you are a customer of Pad2go, we give you a lifelong deal of buying the pads that you get in the market for less than market cost. So you're not obligated to buy from us. You can buy from the market if you want, but if you want to buy the same pads from the market, which we have, we will provide you at less than market cost for a lifetime. So that's one of the two benefits that we have. But we provide that option to the school and the institution or the donor organization to sort of decide, mostly because we are not a charity based organization. So we don't have free pads to give out. But what we can do is give you that subsidized rate, maybe try to connect you to more donors who are able to give you those pads. There have been institutions which have told us that, we need some pads for a while. Is there a way you can get us? So we've tried to work out a system where we sometimes reach out to donors and get them the pads for a certain period of time. But we also want to like highlight that it's not a sustainable answer to constantly rely on donors, to constantly rely on Pad2go as a small organization. The government needs to step up, and that's what we always try to highlight, that let's have a plan. We'll coordinate pads for a certain period of time, but we need to work with the local government to plan what next, because there's already a provision and there's so much money going into providing pads. We need to make sure that is being used. So that's something that we recommend. But obviously, when there is a need for pads, we work with donor organizations to try and get it until a certain plan is in place.
Mm-hmm. Have you all got any pushback from the local governments, as you mentioned, whenever you've tried recommending them helping this cause? Have you ever got any kind of pushback from any of the local governments?
More than I won't say pushback, but I think there's so much bureaucracy, and because Pad2go is really small, we can definitely urge the schools to reach out, but there's very little we can do after an extended period of time. I wouldn't say like it's a pushback, but I would just say there's a lot of red tapeism, there's a lot of bureaucracy, and it's just a very slow process.
Right, a lot of steps to actually reach the main guy. Yeah. I have one last question for you. So everything that y'all have done, it's amazing. It makes me super, super happy that I'm even like talking to you right now. All the things that you do, it's really commendable. And thank you for all you do. You're actually making life easier for all the women who go through menstruation. What can we do as individuals, men and women? I mean, especially women would be more proactive for this cause, but just as individuals to spread awareness around menstruation and maybe also support your cause, support Pad2go. What can we do for y'all?
I think just supporting us in the work and spreading the word. Thank you so much for this opportunity. I think, things like this have been great. Initially, when we started out, it was really difficult for us to get our name out there. We were a small organization. We were just starting out. And I think and it's unfortunate that when international media picked up our work, that's when the national media started picking up our work. So it took a while for national media to sort of propagate the cause, but I also want to stress that it's and we've seen that sort of die down in terms of not just our work. Like, I'm not saying give Pad2go the fame, but it's like highlighting menstruation as a cause. Like, it was a big thing a few years back, and now something new has been taken up. So I think we need to understand that it's a never ending work in progress, and we need to constantly talk about menstruation, especially when newer generation of people are coming. We need to assess if the last 5 years has been able to change anything. If not, then what do we do next? And I know that conversations like these are very helpful because they're able to steer public narrative in a certain way, and that has direct impact at the policy level, especially in Nepal. And I think just having conversations, having open conversations, learning, unlearning, trying to understand what we can do so that the next generation need not have these conversations, I think is important for us to stress on. And I think for women and menstruating individuals, I think it's really important for us to feel dignified and to feel proud and not shameful. And I think the work starts inwards first, because I know that's something that I had to also do, from not using words like not sune, tsui hune, things like that, which have been so normalized and translate to untouchability. So I think there's a lot of inwards that we need to look into, and then I guess change would come about slowly once more of society starts looking inwards and starts doing away with some of the challenges we've had to face in the past.
Yeah, and I guess normalize the word period or menstruation. Um, I I try to use that word as much as possible, like not try to hide it. And I see like the men around me try like get a little uncomfortable, but I guess we need to talk more about it openly so that that discomfort goes away over time. Anyway, thank you very much, Jesselina. I really appreciate it. Do you have any other comments or something else, or anything that we've not really covered, or anything that I really forgot to ask you? Anything that you want to end this on?
I think just to thank you for this opportunity. It's always very refreshing to be interviewed and talk about it, and just it sort of reminds me how much work there is to be done. And I hope people who are viewing my interview with you are able to also do their own work with menstruation. And as young Nepali women, I think it's the unfortunate reality is that the burden is on us to normalize it, and I know it shouldn't be, but there's so much generational trauma that has come about from whatever we've experienced, and we need to work on that and make sure the next generation doesn't go through this. So I would end at that note. Thank you.
All right. Thank you very much, Jesselina. Thank you, everyone, for listening to this podcast. We'll see you in the next one.